Hey guys, Dr. Childs here. Today we're going to be talking about thyroid multivitamins. We're going to be talking about whether or not you should use one, what type of people should be using it, what type of things you need to have in your thyroid multivitamin if you choose to have one, and a lot more. So let's jump into that. If you don't know me already, I'm Dr. Childs and I'm dressed up for Halloween. That's why I'm in this. So you can see I'm a reindeer. So I'm an internist. I specialize in treating thyroid conditions, helping people balance their hormones, and of course, helping people with weight loss. So today, let's get into our topic, and that is thyroid multivitamins. So if you're having trouble seeing this, don't worry because I will be going over it. Oh, by the way, before we get started here, make sure if you're interested in all this sort of information, go ahead and hit the subscribe and the notification bell because I think you'll like this, especially if you have thyroid conditions or you're interested in weight loss and other hormone imbalances and things like that. So first of all, let's talk about thyroid multivitamins and who should use them. Because if you know anything about me and sort of my philosophy, I do think multivitamins have a place in the treatment of various conditions, including the thyroid. But I would be the first to tell you that I don't think it's the best way to treat thyroid problems. I just don't think that's true. And we'll talk about it as we kind of go here. So the question I would pose to you is, well, I guess let's back up a second and say, is it good to use it? And the answer is potentially yes for certain individuals. So let's talk about who those individuals are and whether or not you fit into that category. So the first question I would ask you, or have you ask yourself is, have you taken a multivitamin recently? And if you have, then there probably isn't a good reason to use a thyroid multivitamin, okay? Because we'll talk about some of these other things. But basically what happens is multivitamins in general have a lot of broad spectrum nutrients that are beneficial to your body in several different ways. But a lot of these nutrients don't need to be taken for long periods of time. For instance, I don't think you need to be taking a multivitamin every single day for the rest of your life. But using a multivitamin, if you've been eating the standard American diet, if you have multiple nutrient deficiencies, that can be a good idea for, let's say, 3 to 4 months daily to replete those levels, bring all those nutrients back up to the normal level that you need, and then you can kind of transition and focus on certain therapies that will more directly enhance and benefit your thyroid. So if you have not taken a thyroid multivitamin, or any sort of multivitamin, by the way, then you might be in a position where, yes, it is a good idea to use a thyroid-specific multivitamin. Okay, so the second question I want you to ask is, do you have other nutrient deficiencies? Okay, so generally in life, if you have one nutrient deficiency, you're much more likely to have another. Okay, so let's say you found out that you're iodine deficient or something like that. Well, that's a good indication that you probably also have selenium deficiency and zinc deficiency and B12 deficiency and so on. Because the things that you do, such as stress or eating a poor diet, they don't just affect one nutrient, they tend to affect multiple nutrients. So if you feel that you have other nutrient deficiencies, or you know that you have other nutrient deficiencies, either because your symptoms and you've checked your symptoms, or because you've checked your lab tests, then it might also be a good idea to use a thyroid multivitamin. Now, even in these cases, you wouldn't want to use it, like I said, every single day for the rest of your life, but it has value for 3 to 4 months, maybe up to 6. You take it every single day, you replete those levels, and then you focus on your thyroid. Okay, so the last group of people that might benefit from using a thyroid multivitamin are those who are very confused, okay? And so let me sort of qualify that and talk about that for a second. Now, I talk a lot about the thyroid, and we get into some pretty intense details, okay? We talk about things like thyroid conversion, thyroid cellular activation, different types of thyroid medications, different types of supplements for your gut health and for your adrenal health, and so on. A lot of people listening to this can get a little bit confused. And I know that because I've seen their comments, they've reached out to me via email and so on. So if you are one of those people, let's say you have a lot on your plate right now in life, you just don't have a lot of time to pour into research and figuring things out for yourself right now. I think you should at some point, but let's say you can't right now, then it would be beneficial to use a multivitamin, a thyroid multivitamin, because you can it's a quick and easy way to get all the things that you need. It's not the best way, but it's a quick and easy way to get everything. It's like a down and dirty sort of trick to get what your body needs. Again, it's not a perfect way, so I don't want you to take this and think, well, if I just use a thyroid multivitamin, I'll be okay. That's not true, but it's better to at least go 50% of the way there instead of going 0% of the way there. Okay, does that make sense? So if you're confused by this information, then there is some benefit for you using a thyroid multivitamin. So the next question is, what should you look for in a thyroid multivitamin? So I have a list of things here which I think are most important to the thyroid. Now you'll find that there probably aren't a lot of thyroid specific multivitamins because I just don't think people make them. I have one, but that's because I tend to treat thyroid patients very specifically, so I know what it needs. But if you are going to use a multivitamin, you want to make sure it has specific things because these things are very important for the thyroid. So what I'm saying here is a therapeutic dose of these following ingredients. Now, therapeutic is a word that implies enough of something to allow it to have a positive change in your body. And this is important when we talk about multivitamins because it is really hard to put everything that you need in a multivitamin, okay? Especially if you're only taking a 1 capsule per day multi. If you're taking something like that, there's just no chance that it's gonna have all the things that you need. There's just no chance. Because when you start talking about the high enough concentration and ingredients of these nutrients, it doesn't fit in one pill. It's impossible to get it in one pill. So if you're using a single pill multi, you're probably not getting what you need. And again, it's a logistical problem. You can't fit these ingredients in these dosages into one pill. It just doesn't work out that way. But if you're having another multivitamin, which is maybe multiple capsules, okay, now we're talking about something that might be able to fit, that match these quantities here. So you need this therapeutic dose, and again, that refers to a certain concentration of nutrients. One of the first and most important ones, this is not in any sort of order of importance, but we're just gonna be talking about them, is vitamin D3. So vitamin D3, and I'm saying here that you probably need, I put 2,000 international units here, but you could probably get away with 1,000 IUs. But that's probably the standard lowest dose that you want to have in a multivitamin. And most multivitamins, if you're looking at them like those 1-a-day multis, maybe have 50 to 100 IUs. So we're talking 10 times less or smaller dose than what you actually need in your body. Now, vitamin D3 is critical because it helps improve your immune function, and it also helps with a lot of different things. So you definitely want to be getting vitamin D3 in your multivitamin, preferably 1,000 to 2,000 IUs. The next one is magnesium. So magnesium is very important for thyroid patients because the way that your thyroid works is it can alter how much magnesium you excrete or metabolize out of your body. So states such as hypothyroidism and hyperthyroidism can dramatically alter either high or low the amount of magnesium in your body. Now, most people have hypothyroidism, meaning their thyroid is low, and in these individuals, it causes low magnesium level. Hyperthyroidism is a little bit different, but most people listening to this have hypothyroidism, so they would benefit from additional magnesium. And magnesium is involved in a number of chemical processes, about 300 or so it is very important to get. Now, I'm saying here you want probably to 50 to 100 milligrams per serving in your multivitamin of magnesium. The next one are B vitamins. However, we're going to preface this by saying they need to be pre-methylated B vitamins. So methylation refers to the activation of these B vitamins. And thyroid patients are notorious for having B12 deficiency as well as B6 deficiency. But in order to replace them correctly, they must be in an activated or pre-methylated formulation. So you know if your B vitamins are methylated because they'll have like for instance, B12 will be called methylcobalamin. That methyl means that it has been methylated and therefore is more active in your body. So look and make sure that your B vitamins are methylated. Not all B vitamins can be methylated, but several can, and they should be. Because what that ensures is that if you have the MTHFR defect, which is a methylation defect, that your body can still use those B vitamins. So B vitamins, very important, but make sure they're pre-methylated. Next on the list is zinc. So zinc and we'll talk about zinc and selenium together. Zinc and selenium are so important for your thyroid because of how they impact something called thyroid conversion. In addition, they actually also help thyroid do its job at the cellular level, but we'll focus just on conversion right now. So zinc and selenium, you want to make sure that you have in sufficient amounts. Now zinc, we know that the body can't really absorb much more than 10 milligrams in any one sitting. So you really don't need a super high dose of zinc, which is why I've lowered, as time has gone on, I've lowered the amount that I recommend of zinc after learning about this sort of information. But 5+ milligrams of zinc is usually sufficient. So anything more, if you're getting like 30, 40 milligrams, that's just not being absorbed. So you don't really have to worry too much about that. Selenium, you need about 50+ micrograms, and I wouldn't go higher than 150 micrograms. Okay, selenium, you can actually become toxic in selenium, and once you get too much, you can start having things like hair loss and fatigue and nausea and some issues in your gastrointestinal tract. So you want to be very cautious about going too high on the selenium. A lot of people I know who have Hashimoto's tend to take really high doses of selenium because they've read somewhere that it can produce antibodies, which it potentially can, but if you're taking too much, it can actually be harmful. And then last on the list is iodine. There's a lot of controversy surrounding iodine, but you can and you should take iodine because humans don't create it. I have videos that I go into detail on this topic, so I'm not going to harp on it right now. But yes, iodine is important. Yes, even if you have Hashimoto's. Yes, even if you don't have a thyroid, other tissues in your body still need it. And if you take iodine, especially if you complex it with selenium and zinc, it's protective to your thyroid. So there's no risk of having damage or inflammation in the thyroid gland as a result of that iodine. Now, the dose you're going to want to look for is about 50 to, let's say, 200 micrograms. You don't really want a massive dose in your multi, and it's protected because you're also taking it, or should be taking it if you're following these instructions, with zinc and selenium. So these are the most important nutrients for your thyroid. Now, there are other things that you can add, though, that I'm calling bonus. So if you look down here, you can see this sort of bonus section. And these are things which I think, well, I'll read them to you if you can't see. But these are things which can add additional benefit to your thyroid if they're present in your multivitamin. So if you can get them, you should get them. So anything that reduces inflammation is going to increase thyroid function. That's because inflammation limits T4 to T3 conversion, or the activation of thyroid hormone. So things like fish oil, or things like curcumin, turmeric, alpha lipoic acid, several of these things are anti-inflammatory, even polyphenols, by the way. So you can get polyphenols or fruit extracts and things like that. If they're in your multi, they're usually bonuses. If you can find a good multi, they might have stuff like this in it. But if you get it, that's really helpful for your thyroid. The next thing would be anything that improves gut health, because again, a large portion of your thyroid is converted in your gut. So if you can manage your gut and improve gut function, you will necessarily improve thyroid function as well. So things like probiotics, things like L-glutamine, anything that's calming or soothing to the intestinal tract, these can all potentially help. Another one would be adaptogens. So adaptogens help your thyroid function by helping your adrenals function. These are things that help manage and balance cortisol levels, and they can actually also increase thyroid function as well. And then the last topic would be, another bonus to consider would be botanicals or herbs. So anything that are not things like vitamin C or vitamin D or vitamin E. These are additional things found predominantly from plants. Adaptogens would kind of be like that. Another thing would be like guggul extract. There are several things that are specific to the thyroid which help enhance thyroid function, but they're not traditionally found in these multivitamins. So in a nutshell, there's a lot that you need to understand if you're going to use a thyroid multivitamin, if you actually want it to be effective in your body. Now, I have a thyroid multivitamin which fits all of this criteria. Of course, I was the one that created it, so I knew what to include in it. I'll have a link below if you want to take a look at that. If you don't want to use it, that's fine. Just make sure that you hit all of these checkboxes here. Find and just look at the back, make sure the ingredients are all kosher, and they, not kosher in that sense, but make sure they have all these ingredients so that you know, in these therapeutic dosages, so that you know it's going to be working for you. So if you have any questions, leave them below. I'm really eager to see if you have used a multivitamin in the past specific to the thyroid, whether or not it's helped you. By the way, also don't forget to download my free thyroid resources. I have a huge list of thyroid resources which can help you do things like figure out which foods you should be avoiding, a list of optimal thyroid lab tests, and so on. So make sure you download that. I'll have a link in the description below. And otherwise, I will see you guys in the next one.